My name is Nathan Neufeld. I'm the Medical Director for Pain Services and Supportive Care for Cancer Treatment Centers of America, a part of City of Hope. So the main thing that I hope people can gather from my talk is that pain management is often minimized by patients and also minimized by providers. And ultimately, it's something that really impacts patients severely and can really impact quality of life for them. And my hope from my being here is to share and almost evangelize the idea that we need to take a bigger stance against pain for cancer patients, and that there's more that we can do than just narcotics, although that is a major piece of what we do for them. There's interventions and techniques and other providers that can really help coordinate and optimize the pain management for cancer patients. Something that is really, I think, taking a lot of momentum in the cancer space, especially for late stage patients that have a lot of spinal pain from spinal bony metastasis. There is an increase looking at a lot of research that's gathering in the body of literature to really do ablations and or treat the pain of patients directly at the source of the tumor in the spine. So, that's an area of my expertise and what I do a lot of. And I think it's something that IR, neurosurgery, orthosurgery, and pain management doctors are really involved with doing these ablation techniques where we're treating fractures of the spine in a cancer patient. And as they're living longer and patients are being cured more and more from cancer, I think these natural sequelae and natural history of these disease processes needs to be addressed as directly as possible. So that's kind of where this almost like a minimally invasive or interventional pain for oncology is really taking shape.